Hey everyone, it's Craig with One Man's Cancer Journey. Thanks for joining me today. Today, topic's kind of where do we go from here? And it's an expansion on my PET results from last week. So on Thursday of this week, I had my chemotherapy treatment. And as usual, before that, we meet with Dr. Tejani and Fadl to review the care, how it's going so far. And so this was the first opportunity that we had to talk with Dr. Tejani regarding the PET scan results, other than the email he had sent in last week. And so what we learned from the discussion was that he did confirm that the mass in the stomach is pretty inactive. And so we're pretty happy about that. That's good news. But again, like most things, it's mixed results. So we are seeing quite a bit of activity in my liver. And so we're not seeing shrinkage there. And one of the things you might ask is, well, now that the stomach mass is done, could you do some liver specific treatments? The answer is yes, we could switch over to do something like a radiation. But the challenge that comes there is that radiation is really going to just target what's in the liver. And so if we start to hit it with radiation and it starts to spread, the radiation won't do anything for the spreading because it's such a targeted therapy. So really what we're looking for is shrinkage in the results that are in the liver. And if we start to see shrinkage, then we could think about some targeted therapy. But if we don't, then we would, I don't know that hope is the right word, but over the next 2 or 3 months, we would anticipate that we'll start to see the cancer grow, meaning that it's become resistant to the current regimen or therapy that we're going through. And so this is why we are trying to set up our consultation for a second opinion at the Mayo Clinic. So we have faxed them all of the documentation of my condition and some of the test results, and we're waiting for them to review that and be able to try to set up to do a consultation with them in Mayo Clinic. The hope here is that if we do see in a couple months or a couple more treatments that we're starting to see the masses grow in the liver, that they may have some new treatments or therapies or clinical studies that we could participate in. And so I'm really grateful that Dr. Tejani had encouraged us to get that going so that we're in as patients and we wouldn't have to be a new patient. So as soon as we see that growth, we can start to explore different treatment options. We are thankful that we decided to continue with the chemotherapy because my physical condition has been so good and I haven't deteriorated. We continued with the chemotherapy. He truly believes that with the results from the PET scan, that if we had just switched to the immunotherapy and the clinical drug, that we might start to see some growth in that cancer that's in the liver. So that's kind of the update of kind of where we are in terms of treatment and why we're continuing with the current regimen. We want to continue to maintain it and hold it as long as we can. And as soon as it shows that it's no longer effective against the cancer, then we will move on to a new treatment. And we're taking those steps with the consultation at Mayo to be ready to take immediate action and not have to delay by any weeks or months, moving from one step to the other so that we can kind of try to stay ahead of this cancer. For my gratitude moment this week, I'm grateful for Fadl, who is our coordinator at Advent Health. Not only does he handle making sure that our appointments are scheduled and checking us out of appointments, he takes the time each session or each time we go in for treatment. He walks us up from the doctor's appointment takes us up to the infusion center, and then he goes and talks with our nurse to make sure that we're taken care of. But in addition to that, this time around, he sat down with us and talked to us about what the PET results were, and that we shouldn't be overly discouraged, but that this is a good sign that, it can get us ready for the Mayo Clinic, which is a tertiary hospital, meaning that they don't take people who just have started treatment, but they're taking people that have already been going through some treatment and they need some advanced care, meaning that they need newer things to take care of them. So we're grateful for, I want to say, friendship that Fadl has given to us, the fist bumps, the hugs, the reassurance to us when we get news that we weren't expecting or wasn't as good as we expected. We're grateful for the way that he cares for us. And so that is my gratitude for this week. My name's Craig. I'm with One Man's Cancer Journey, and I wish for you a blessed week.